talking about resilience in the face of poor healthcare in the developing world. First of all, poor healthcare is one of the largest deterrents to a high quality of life in the developing world. Close to 6 million people a year will die, shown specifically in India, where 2.4 million people die per year of inadequate healthcare. Because of this, many people don't seek treatment for their issues, and this creates a historical stigma against going to the hospital or seeking treatment. This issue mainly affects countries in which there are poor social situations or they're in deep debt or poverty. Let's look at this map, for example. Large parts of our globe are swathed in deep red, according to the Lancet, showing that a large portion of our world experiences inadequate healthcare, meaning that most will never fully live up to the life they need. So this led me to my driving research question. How can people in the developing world overcome the burden of poor healthcare? My ultimate solution was that non-governmental public health informational campaigns would be the best solution. But to understand how I got there, let's look at some of the biggest contributing factors, namely the cycle of poverty. According to Anand Saharasan from the University of Creia, a professor of both mathematics and an expert on social sciences, his modeling shows that in areas of increased poverty, there's also increased illness due to overcrowding, contact with animals, or open sewage. This ultimately leads to illness. But as he noted, in areas in which there is poor health care, treating these illnesses can be an extreme struggle. This may lead to extreme psychological stress, which leads to a loss of autonomy and overall void thinking. This concept of void thinking was described in the research from Haitian survivors in their own words, in which severe psychological stress led to what they called void thinking, in which it seems like nothing can be done to improve one's situation. This helps contribute to that cycle of poverty as seen before, and many of the people living in these areas will experience it. Furthermore, there are extreme social restrictions to proper healthcare, namely both war and corruption. Looking at the Red Cross's study in Ethiopia, it can be seen that many of the hospitals and institutions of healthcare in the area are severely impacted by war, especially the civil war going on in the area. 73% have been severely damaged, leading to not only an inaccess for most people, makes it dangerous to even try, leading to that psychological stress and issue of poverty emerging again. Furthermore, corruption is a huge issue. A survey among people living in those areas were taken, and close to 83% viewed corruption as the largest issue they encountered. 47 believed that it was the largest in limiting their access to proper health care, meaning that these hospitals are experiencing severe limitations, and the people who are trying to go to them are experiencing severe limitations, making the burden great on both. Furthermore, there's been historical dissatisfaction. In a research paper taken in Bangladesh, many felt like historically up to 2005 that their concerns had not been properly addressed, leading to those feelings of a lack of autonomy and an increased psychological stress. Overall, increasing again that void-like thinking we can see in the study Haitian survivors, leading us to recommendations. First of all, I tried to look at 3 solutions to potentially solve this. First was rebuilding health systems, then government public health informational campaigns, and then non-government designed public health campaigns. We'll start on my final solution or ultimate solution. First of all, a lot of these non-governmental campaigns are trusted sources, and that means that people are more likely to follow them, especially in the age of the internet. They have money specifically designed to promote awareness, and this increases autonomy because it can show people the steps they can take to actually prevent disease or help treat themselves if they come across something milder. However, there's also some of the limitations. First of all, this would not treat things people have already incurred. Furthermore, it can only go as far as the internet. And potentially the most important is if this is only as far as the internet. The globalization of language and the overprevalence of English as a language on the internet could halt full access for people who actually need it, according to statistics.com. The next solution I looked at was rebuilding. This would be ultimately the best idea, but it is too limited by unrealistic factors such as price. A country like Yemen, with a GDP of $38 billion a year, simply could not afford to build such institutions. Though they're better equipped to technology, they're limited by corruption and could be destroyed by war, such as this hospital in Yemen as a Doctors Without Borders institution. Furthermore, a hospital in Lebanon was destroyed due to bombings and corruption from the government. Furthermore, the final solution I looked at was the government public health campaign. And these are a good idea because they can reach large amounts of people, and governments are better suited for the needs of their citizens. But a lot of the times, governments are not trusted. And we can see this in the case of the Ebola epidemic, where according to worldvision.org, there were many improper burial techniques for those who suffered from Ebola. And this led to overall more Ebola cases because people distrusted what the government told them. This ultimately leaves the best solution as non-government informational campaigns because it maximizes trust and it gives people a greater sense of autonomy, reducing psychological stress. And here are my works cited.
Thank you, Marianne. Could you tell us what information did you need that you weren't able to find or locate, and how'd you go about trying to find that information?
So one of the biggest issues I had when trying to locate information was finding accurate information in areas that have been torn up by war, because information is so hard to acquire, especially trusted information. The best thing I could do was try and look at Red Cross and other medical websites like Red Cross and Doctors Without Borders, because I felt like they would give me the best information about the current state of hospitals in the area, and such as other things.
Thank you. And then finally, what additional questions emerged from your research, and why are these questions important?
Well, when I went into this research, I looked specifically at healthcare as a whole, but researching what Anand Sastharan said, it made me think specifically about epidemic disease and how it impacts people in poverty. I had a bunch of questions afterwards, like how does poverty impact specific epidemic diseases, and how do these specifically burden healthcare systems, and in what ways can healthcare systems be adapted to answer these? And this is important because as epidemic diseases arise, especially zoonotic disease, there's a greater risk for not only specific countries, but also the entire